Alrighty, well, good afternoon, everyone. Welcome to yet another Roswell Park Ask the Experts webinar. Today, we've got a pretty interesting focus. We are going to look specifically at young adult cancer patients and the COVID vaccine. I'm Rebecca Vogt. I'm the Media Relations Specialist here at Roswell Park Comprehensive Cancer Center in Buffalo, New York. Now, it's kind of almost hard to think about, but we've been dealing with COVID and its limitations for almost a full year now. I mean, it's really it's hard to believe. And that we're all doing things now virtually on this platform. Who would have ever thought? Should have bought some stock in Zoom. But now that there's finally a light at the end of the tunnel, as we move forward and vaccines are being distributed to the general public. And while many people are, of course, jumping at the chance to get the vaccine, we've also seen some hesitancy. Our young adult population we're finding that they're a little bit more concerned than others and are asking a lot of questions about potential side effects and long-term effects of the vaccine. And today we're going to get to the bottom of some of your burning questions and concerns surrounding all of that. I am fortunate to be joined by two wonderful individuals this afternoon. First, we have Roswell Park's Director of Pediatric and Adolescent Cancer Survivorship and the Director of the Young Adult Program and Oncofertility Program. We have Dr. Denise Rokicka, and also our Director of Infection Control and Prevention, Dr. Catherine Mullen. Thank you both for joining us today. We will start off first with Dr. Rokicka. Can you tell us a little bit more about your role here at Roswell?
Sure. So I, as you mentioned, I'm the director of the Young Adult Program and the Oncofertility Program. Through those programs, we try to connect our young adults with other resources, either throughout the Institute or throughout the world. And then with the Oncofertility Program, we discuss fertility preservation and connect to resources that can help with that as well.
Thank you, Dr. Rokicka. Dr. Mullen.
Thanks, Rebecca. So as Rebecca mentioned, I am the head of infection control here at Roswell Park, and I am also a practicing infectious disease physician. So when I'm not doing infection control related things, I am seeing mostly inpatients who are Roswell Park patients who have infections. So.
Excellent. Thank you for that, Dr. Mullen. We do have a whole heck of a lot to discuss, so we're going to dive right in. We're going to start off with a couple of pre-submitted questions, but this is an open forum. Please remember that you have the option to submit questions at any time during this chat. There is a little chat bubble down below where you can ask it, or there is also a question function as well. You have the option to attach your name to it, or there is, of course, an anonymous option if you don't want your name to appear. We're going to try to get to as many questions as we can within our time allotted, but if your question is not answered, don't hesitate. Feel free to call your physician or also 1-800-ROSWELL. And also for any of your friends or family members who didn't have the chance to tune in today, this webinar is also going to be recorded and emailed to you for sharing with everyone else. So I think we're going to start with, there's two sort of off the bat questions about COVID, and then there's a lot about the vaccines. So one of the first things right off the bat is that, there's this thought process of, well, most of my friends who have had COVID have had like very mild symptoms or not at all. I don't feel like my life is at risk. So like, what sort of message do you have for folks who may be feeling this way? I guess, Dr. Mullen, that might be toward you.
Sure. Yeah. And I think that is understandable when a lot of people's healthy family and friends who are around the same age. Most COVID courses in that age group are pretty mild. That's true. But we also know that cancer patients can have very much more difficult courses with COVID. So there is a small percentage of young people who get very sick with COVID. And the patients who are immunocompromised, like cancer patients, tend to fill an overwhelming portion of those people who have severe cases. And so we do worry more about you than we do about your healthy friend who doesn't have a cancer diagnosis.
I would also add to that too, that, some of our therapies, radiation therapy, chemotherapy, can certainly affect heart and lungs. And so there may be increased risks just related to their types of therapy too.
That kind of leads me right into sort of the next question about, there's also a crowd of people who are worried about the long-term health impacts from COVID. We're hearing about the long haulers, what have you. I have a lot of life ahead of me. What do I need to be concerned about if I get COVID as a young adult?
Right, and I think that that is very much something to consider, and very much why we now have this almost miraculous tool of vaccination, which I know we're going to get to. But preventing COVID is very important because we don't know the long-term side effects. We know that COVID can cause definitely short-term heart and lung issues, and then just sort of gross inflammation elsewhere. And we're really going to have to look. There are many hospitals throughout the country are now opening what are called long hauler clinics to look at how the chronic symptoms and the chronic inflammation that's related to this virus. So people are having chronic medical problems even after they've cleared the virus itself. One of the things that happens with severe COVID cases is that the virus triggers a very bad inflammatory response, in some patients more than others. Those are the patients that get severe cases. So at some point, it's not just the actual virus that's creating damage, it's the inflammation the virus triggers.
So we're going to shift now to all of the questions about the vaccine. And I mean, one of the big things, I mean, and where you see it everywhere, people posting about it left, right, and center. How do we know if the vaccine is 100% safe if we don't have the long-term studies or data? I know talking the other day about, how stuff comes out when the EUAs come out, the emergency use authorizations for people who don't know that. But that's like, just from the studies and what have you. So yeah, how do we kind of, look at this if we don't have that bigger, broader picture?
Sure. I mean, I think we do have some data that shows in the short term that these vaccines are very safe, and that should be very reassuring. Anyone who says 100% that any drug, vaccine, medication is 100% not going to cause something, potential long-term, we don't think it will, and all the available evidence, if we thought it would, we would be very transparent about it, transparent about the risk. But there's no way to say 100%. What we do know is that for sure, getting a COVID infection is much more likely to cause chronic long-term issues than anything related to the vaccine. So it's much, it's from a risk-benefit analysis, the vaccines in general, they're very, very safe. And that's a message that we really want to get across, not just for this vaccine, but for all vaccines. It's really important for our cancer patients to understand that vaccines save lives. They are safe. Vaccine studies tend to be the most rigorous of all clinical studies because they are something preemptive, right? They are given before you get a diagnosis, not because of a diagnosis. So they have sort of the highest threshold to go through in terms of safety. And our vaccines that are approved have met that threshold. And so they are safe, and we can say with very high certainty that we don't think anything bad is going to happen long term, but no one can say 100% pretty much about anything or any therapy. We know that people have very individual reactions based on genetics, environment, things like that, to a lot of different things, including drugs. And so, everyone has, just like having sort of different adverse reactions to drugs, there's no way to say 100%, even though we can say definitively that it's overwhelmingly safe.
And I just want to piggytail on that. I think the comment of risk versus benefit is really important to consider the long-term side effects of COVID, but also, I mean, that's just in general in life, right? We are always making choices that could have some sort of risk or benefit. And I think knowing now what we do know about the long haulers and the COVID, the lung problems and things that are following COVID, we really need to consider those as well.
This could be a question for either of you to answer, but I mean, why is it especially important for those with cancer to be vaccinated?
I'm happy to sort of start, and I'm sure Dr. Burkett can pitch in her thoughts too. I think, again, we see more poor outcomes, more severe cases, especially in young persons who, have cancer diagnoses. And so, again, we worry that the likelihood of having a severe case and also that having impacts on your ability to receive cancer treatment are pretty significant. So, we hear all of the time about concerns about people being worried about chemo being delayed or surgeries being delayed or things like that. We really obviously want to get people the cancer care that they need in the fastest, most effective way. And we don't want anything to trip that up. And COVID is something that obviously can, potentially have detrimental side effects both for your immediate health, but then also could have impacts on how efficiently you can get care for your cancer.
I would just say the same. I mean, I agree with 100% with what you said. The delay in treatment it could be potentially life-threatening in and of itself.
So the other big question that looms for, I'm sure many of our young adult patients who are tuning in this afternoon is, can I get the vaccine at Roswell Park?
Yeah, I think one of the things that's been really challenging operationally throughout this pandemic is actually, it's honestly an amazing feat of science and public health that we've gotten incredibly effective vaccines. Like, I mean, mind-blowingly. I think that if you had told me last year that we would have vaccines that are 95% effective against a virus, which, has existed and we've had not successfully created vaccines for it prior, I would have said no way. And I would have been thrilled if we had gotten a vaccine that was 60% effective. So, we know that vaccines are super effective, and so, and I got off track, Rebecca. So,
Can they get them here at Roswell? What are we seeing?
right. Sorry. So one of the challenges though has been operationally how to get out. Obviously our focus here at Roswell Park is our cancer patients, but this is a global problem and a global battle. And we are getting vaccine to our cancer patients as soon as possible. But we are very dependent on a distribution modality that we do not control. So when we have vaccine, we will get vaccine to our cancer patients. And there is, the highest risk patients will be stratified first to have availability here. I would encourage anyone to, if you are now eligible from New York State, to get vaccinated at any of the general New York State vaccination sites. So do not wait for us. So if you have the possibility, hopefully at some point we will have enough vaccine for everyone. But right now, if you have a chance to get vaccinated at another site that is getting sometimes a bigger bulk of vaccine shipments, please pursue that, because I think that especially for our younger patient populations who don't tend to be, obviously our older cancer patients are even a higher risk for severe disease and death because of a coronavirus. So, if you do have that opportunity elsewhere, we would urge you to take that, the soonest possible.
And I know when the state opened up and added the comorbidities, so cancer was on the list. So that does bump up anyone of, that 16 and up range, correct, to try to sign up where they can. Okay.
Yes, exactly.
So moving forward, there was one question that actually came into us from social media, and this kind of leans into what Dr. Rook, you were kind of talking before about radiation and chemo, but can I get the vaccine if I'm currently undergoing cancer treatment? There was a question about, like, is the vaccine going to react to dye used within MRIs that my son or daughter gets, or to the MRI itself?
Yeah, you can definitely get the vaccine. There's no interactions. I know there have been some reports of lymph node swelling after getting the vaccine, and I understand that our mammography department is recommending waiting at least 8 weeks after your last shot to get any imaging. That being said, obviously we would still, if you're in treatment, we would still be still following your scans to make sure your disease isn't coming back, but would definitely recommend still getting it. There's no interactions that we know of.
And I just wanted to add in, just with some of we're learning on the go with a lot of this because this is a brand new virus, and obviously brand new vaccines too, and a brand new, in studies, these weren't studies that were done specifically in cancer patients. So while active treatment is not a contraindication to getting the vaccine, we cannot say that it does not, there's no data. We do not think that it has any interaction with cancer treatment or whatnot, but we cannot say definitively so. Again, we would urge, we think that the benefit of getting the vaccine is overwhelming compared to potentially getting COVID. So we urge you to do that, but we just want to be sort of super transparent that there's not data that has looked at each of these different treatment modalities and how it interacts with the vaccine. And then in terms of imaging, for screening imaging, as Dr. Rook just said, it is recommended if you get the shot to be delayed, and this is by National Breast Imaging Guidelines, to be delayed by several weeks, but that is only for screening without a indication. So if there's something of concern and you're recommended for imaging, we recommend not getting delays at all. So I just want to make sure that message is out there, that this is more for routine management, routine screening. We don't want there to be any confounders or make things a confusing situation for people because of changes, that transient changes that the vaccine can create. But if someone has a lump or something that needs to be evaluated, they need to be evaluated ASAP. It doesn't really matter when they got their vaccine.
Absolutely. And I know we've seen a lot of news stories come out recently about the, the swelling in the lymph nodes and what have you. So thank you for that clarification on that for any of our survivors who are on here who are getting routine mammograms. And also for those who may have, an indicator to have to get further screening. One other thing is we saw a little bit about this when things started first rolling out. What are we hearing about allergies lately? I mean, if someone has allergies, is it safe to get the vaccine?
So in terms of safety, I think if you talk to most allergists and immunologists, they would say in most cases it's totally safe to get the vaccine. That being said, I would very much suggest if you're under the care of an allergist or immunologist for a severe allergy, that you touch base with them to make sure that there are no concerns in your specific case. Specifically with immune system issues, they tend to be very individualized. And again, in most cases, it's totally fine to get the vaccine. But if you have a severe enough or a unique enough case where you are under the care of an allergy or immunology doctor, we do recommend that you touch base with them about any concerns.
And one of the big things I'm seeing within even, people in my age group too is, the big F word of fertility. And Dr. Akika, this is your bread and butter. Folks who are really concerned about the vaccine affecting fertility. What are you telling folks?
I think, again, there's no data to suggest that there's any issues with long-term fertility, but again, it's also newer, but there's no data to suggest that that's an issue or a concern.
And I could just add one point to that. The fertility issues, obviously I'm a big vaccine proponent being an infectious disease doctor. And one of the things that has overwhelmingly been a big myth campaign of anti-vaccine campaigns is that vaccines somehow affect fertility. It's a very effective mechanism to sort of breed anti-vaccine sentiment, because obviously this is a really big deal to young people. Fertility really shakes, and your future really shakes you to your core. And so if that seed is out there that there may be a problem, that's a very effective way to discourage people from getting vaccinated. So I would just reiterate Dr. Akika's point that we have no data, nor do we think that in any medical field, do we think that this will affect your fertility? I mean, I think both ACOG and the Society for Maternal Fetal Medicine came out very strongly, in support of young people getting this vaccine, pregnant women having access to this vaccine. So, we obviously, again, we want to be transparent about what we don't know, but none of us in the medical field, we are looking out for you young people. If there were real concerns about long-term fertility issue, we would be very transparent on that front.
Thank you for that. Moving forward, for the folks who have already had COVID, is it safe to get the vaccine? And do you have to get the second dose if you already had COVID?
So you should get the vaccine. Ultimately, we recommend that you wait 90 days. You should have natural immunity, at least for that period, probably a little bit longer, but beyond that, you should get the vaccine because it will protect you for, a more set period of time that we know. We know that eventually we think that natural immunity will diminish. So, again, would definitely, recommend that people do that even if they've had a case in the past.
The question about the short-term side effects after the second dose. I mean, why are they so bad? I mean, yeah, I had that experience myself. Got the second dose at like 6 p.m. The night before, woke up with the chills and what have you, and was totally fine the next day, resolved by dinner. But yeah, why is it really just, knocking us down for the count with that second dose?
Well, so it's interesting, Rebecca, and I think it's valuable for people to share their individual experiences, again, because I think we need to normalize the fact that some people will have, short-term side effects that you wouldn't want to have long-term. That being said, from a risk benefit standpoint, even the risk if you're one of the minority, and again, it's a minority of patients who have this. So I'm sorry that this happened to you, but again, most people's experiences are that they do not have severe side effects from these vaccines. I think one of the problems, one of the things I know, for example, it's been circulating on social media that's become a big deal about the second shot. There's a lot of anxiety, and I've seen this in our cancer patients, a lot of anxiety about the second shot, even more so than the first shot. So I feel like that time between their first and second shot, like everyone's anxiety goes through the roof. It's really, at this point with what we know, we really are encouraging people to get that second shot because it sort of gives us information that it's much more likely that you're going to have sort of like this long-term immunity that we really want you and the population at large to have. So yeah, I would say that, we should be upfront that it's a possibility, but again, it's much less severe than getting sick with this or the potential of getting sick with this. And then the last thing I would say is that other vaccines coming down the pipeline are potentially a one dose vaccine, where I think that one of the benefits will diminish that potential anxiety between the first and second. That being said, there are pluses and minuses to getting, the different vaccine. Anything that's been approved has been shown to be super effective, and that, for the majority of people, they are not suffering from severe adverse reactions from the vaccine, the first or the second dose.
Yes, and I do want to add, I'm not trying to instill any fear in anyone. This is just, like I said, my individual experience. People are sharing their, and we want to hear good, we want to run the gamut. We want to hear everything from everyone, and please do not feel anxious. I mean, as Dr. Mullen had said, the chance of it happening outweighs, the symptoms that you and what you could get if you do get COVID. So please bear that in mind, as you sign up for your vaccinations, as they come up. So one thing I do want to transition to, it kind of still has the same sort of thing though. There are some people who, if I have no/very mild side effects, does that mean it is or it isn't working?
So we do not think that your side effects are related to your immunologic protection. So we don't think it has any. So it's kind of a bummer for people that get side effects because I don't really think that they get immunologic benefit out of it. I think it's the same as someone who doesn't really have any side effects from either of the vaccines. So we know that across the board, that again, a minority of people have these side effects, but then 95% of people are completely protected from getting severe cases of the virus. So that is pretty good data that shows that a lot of those people who did not report adverse symptoms from the vaccine are very, very protected.
So a couple of sort of big picture questions now. If a large portion of the population is signing up and getting the vaccine, why do I need to? Won't their immunity in turn prevent the spread and also prevent me from getting COVID?
So I think that I understand why, especially when we talk about a lot of this discussion about being nervous about side effects, why people would say, well, why would I have side effects if I'm going to be protected by everyone else? But to be honest with you, again, especially for our cancer patients where we worry they could have more severe cases, you do not want to take that risk when you have a very safe and effective vaccine that could completely protect you. It's always better to be proactive and take charge of your own health. And I really would recommend, even though I really also advocate, I think one of the things we really should do, there are some vaccines that some cancer patients cannot get. And that is where we really encourage the community to say, listen, this is not just about you, but this is about sort of being a good citizen and saying you can get this vaccine. You need to protect the vulnerable people around you. So it really, for our cancer patients, it needs to be a combination. It needs to be a combination of encouraging your friends and family to protect you. And I think Dr. Rakicta, being a pediatrician, they talk a lot more about the cocoon effect. And I think that's something we should really be talking about more in adult medicine, where the people around you should really be cocooning and protecting vulnerable persons. But considering that cancer patients can get this vaccine, we should also be being proactive about protecting yourself as well.
Yeah, I would just mimic that as well. I mean, I think it's really important for us to not just think about ourselves, but also to think about all of those around us, and those that maybe can't get the vaccine or aren't in the right age group yet. You're still protecting yourself, but everyone around you too.
This next question can kind of be for both of you, and because it does relate to younger populations. So it says, why is the vaccine not being given to children? I'm not that old. I'm suspecting a teenager, that sort of thing. Do I really need it?
The studies were initially did not include pediatrics. Those are ongoing now. And we expect that, the EUAs or the next coming up vaccines will include pediatrics, but right now they're only go down to age 16.
Yeah, and I think there will be big discussions ongoing because kids in general, especially kids who do not, and it's not really relevant to this conversation, but kids who are healthy kids rarely get very sick. And so at that point, there's a discussion about, is there more of a risk? And that's why we're really going to need studies to show this. Is there more of a risk of having an adverse event versus actually having the virus itself? We know in adults, includes this, the audience that we're talking to now, there's a much higher chance of having a severe outcome from the virus. And that's not true for our youngest patients. So we really have to look at that data and tease out, again, so we're being really transparent and honest about a risk benefit situation.
So when will we know more about the frequency of vaccination, or how long it's going to last for? I mean, is this gonna end up being something that we have to get a booster for every year, like we get the flu vaccine? What's going out there in the stratosphere of research and looking into frequency and how long it lasts?
Yeah, so I think, again, it's crazy to think about how much has changed in a year, right? So last year we had no approved or even functional vaccine candidates for this entire family of viruses, and now we have multiple ones that have been shown to be very effective. So we do not, because we only started the studies in the summer and early fall, we do not have long-term data. And so we can make conjectures about how long it will last. And I think that there's thought that that potentially this vaccine-related immunity will last longer than natural immunity. But these are all educated guesses. And we're really going to have to look at that cohort of initial study patients to see how long they are protected for. It may be that at some point, and I don't know what duration that will be, that people need a booster. But it will really depend on a lot of things, including sort of local circulating viral presence, whether or not right now the variants we have, the vaccine should cover them. But, as time goes on, situations can change. And so we'll have to see, the flu, one of the reasons that, just for clarity for people, one of the reasons that you get an annual flu shot is that the flu genetic sequence changes every year, that it shifts every year. And so your flu shot from the previous year, it probably looks pretty darn similar to the flu vaccine for the next year, but it's imperfect just enough that it's not going to protect you. We don't think that there's going to be the same seasonal variations in this virus, but again, this being so new, these are all really educated guesses, and we're going to have to see how this plays out.
And you did touch upon a little bit about, vaccine covering the new variants. So I'm going to jump ahead. And actually, this is something, Dr. Mullen, you and I have kind of talked about this week. Will there be more vaccines authorized soon in the US?
Yes, I'm very hopeful that tomorrow we will be getting exceedingly good news that the Johnson & Johnson vaccine will be approved. We're waiting for the official approval, but all signs look very promising. There are some details that the EU committee is going to have to piece out. So one of the things, there are some slight differences. For example, Pfizer was approved from 18 and up, Moderna was approved for 16 and up. So there's some slight differences, and there may be some things like that we would have to say that the eligibility would vary differently, but we don't expect it to be significant differences. The benefit of this vaccine is that it is a one-shot vaccine, and from getting things out to the community, getting things to you all, that is a tremendous operational coup. One of the big issues with our current vaccines, while they're super effective and fabulous, and I feel very sort of blessed that I was able to be a Pfizer vaccine recipient, is this having the second dose and making sure that people match up with a second dose and that they're around and whatnot. Is definitely logistically more challenging. So a one-shot vaccine is going to allow us to get massive dissemination of vaccine to the community at a much faster rate. The efficacy does differ a little bit, but I did just want to take this opportunity to say that, that's somewhere between 66 to 70%. I did want to say that that's still really good. So, I think, the Pfizer and the Moderna vaccines sort of overshot how amazing they are. And so it sort of skews our opinion of how good a vaccine is. But the Johnson & Johnson vaccine is significantly better than any flu vaccine, which I still very much encourage you to get. But just for comparison reasons, that is a very, very effective vaccine. And I think that if that is disseminated quickly to the community, that can really help drive herd immunity too. So I think it's going to be a great tool. I did want to, also say that it's kind of a situation where get whatever vaccine you can get. If you have the Moderna, get that vaccine. If you have eligibility for the J&J vaccine, get the J&J vaccine. I think, again, there are some slight differences, but really seize the day, and whatever you have earliest access to, we really encourage you to use.
Very good. Yeah, we'll all look out for that, and I'm sure that's going to be big news when it happens, or if it happens Friday. Just to kind of circle back on it, yeah, we shouldn't. I mean, don't vaccine shame. I mean, if you have any and all options available to you, just take it. And I think, as you had mentioned earlier, Dr. Mullen, that if a year ago you had told me that these vaccines were going to range anywhere from like 60% to 90% efficacy, like she said, I mean, you would have been floored. So now that we're at this point, I mean, it's very exciting to see that these numbers are here, and that people should be, signing up for their appointments no matter what is being offered. One sort of last thing I wanted to kind of tie everything together with a little bow, and this can be something that both of you answer, is, I mean, it's definitely another thing that's kind of on everyone's mind, as some people do find that they're kind of fatiguing around all of these precautions and whatnot. When will we be able to stop masking, social distancing, etc., and get back to our lives now that we've had the vaccine, it's rolling out, and we're moving forward?
I mean, I guess the short answer is we probably don't know, right? It'd be nice to say tomorrow, but of course that's not necessarily realistic. But I hope that once more of these vaccines are out there and more people are vaccinated and our numbers are mostly going down, I think in most places now, that hopefully we're getting there.
Yeah, and I mean, everyone who has COVID fatigue, I really feel ya. I think everybody does. I know those of us in the hospital, like, it's so painful that we still have to do things like have visit limitations on visitors, and have a lot of these things that really, we thrive on human interaction and human touch, and I feel like we've all been very deficient for the last year on that. And so, we will get you back there as soon as we can, because we realize how much of a sacrifice it is. But I also urge people to hang in there a little while longer, because, I think that if everyone sort of can hang in and practice sort of these good bread and butter public health things that we know are effective, while we're waiting to have increasing herd immunity, we are seeing rates dramatically lessen. And the projections are, if we can make sure that vaccines operations in terms of delivery stay ahead of any variants that are more transmissible, that we really can get to a normal place sooner. So, hang in there, continue to be careful about what you're doing, and putting yourself in high risk situations, because the longer we can do that while we still have circulating virus, the sooner we're going to get back to a normal place. The other thing I wanted to throw this out as being sort of a positive is that one of the things that all these COVID precautions have done is really protect you all much more significantly this winter. So, I think that we've all been, having these altered lifestyles because of COVID, but we've always recommended that our cancer patients who are undergoing active treatment or immunosuppressed because of their cancer itself, be more cautious because they are at risk from not just developing conditions related to COVID, but prior to that, a lot of people who I was seeing in the hospital had severe cases of other respiratory viruses that tend to be seasonal. So the worst, period of time is November through March, April-ish. And I have to say that it's crazy looking at statistics, just even internally, and then this is replicated nationally and internationally, is that these precautions have driven all of the other respiratory viruses into the ground. I have never, as an infectious disease doctor, I never thought I would say that I went an entire season without seeing an influenza case. I have seen zero 0 cases of influenza this year, which is not just me. It's not, I've been working, don't worry. It's not like I've been on vacation. It's that, no one has been seeing influenza. And I know, I don't want to speak for Dr. Rokicka, but I know the pediatricians are just floored that there's been almost no RSV. So, and we also see this in some of our, our transplant patients and whatnot. But this is a huge positive. And so in some ways, while we have been sacrificing, in some ways, all of these individual and societal sacrifices have led to a healthier environment for you this winter.
All right, before we close it out, I kind of want to just go to final thoughts to anyone. Dr. Rokicka, I'll start with you. Are you hearing anything else in your clinics with your young adult patients? Anything top of mind that you want to get out and share? Any other additional advice?
Nothing specific, I would say, but I do, just final thoughts, like encourage, if you can get the vaccine, whichever one it is, go get it. As far as we know, we don't know there are any long-term side effects. The side effects of COVID are worse than the side effects of the vaccine. Even if you have side effects, which I did as well, they're gone in a day. They're not long-term. They're not lingering. I'm fine. So get the vaccine. And if you have questions, certainly call us.
Dr. Mullen.
Yeah, I would just echo most of those points too, that we really do believe, we are vaccine recipients ourselves. We really do believe that this is effective and will protect you. We are being super upfront about what we know and what we don't know. And so, if you do have any questions or specific questions related to your own cancer treatment, you can always touch base with your own doctor about any individual concerns you have. Again, there are currently clinical trials that are going on in cancer patients. And so over the next few months to year, we will know more information, but we suspect that this will be highly effective. And we do not suspect that this has interactions with, cancer related outcomes or therapies, except that it protects you, of having COVID cancer related poor outcomes. So we really, really urge you to seek vaccination wherever you can get it as soon as possible.
Thank you both for those closing thoughts. We're now at the end of our time here for our webinar this afternoon. Lots of helpful information. We hope you got something out of it. Thank you both, Dr. Rokicka and Dr. Mullen, and for taking time out of your day to take part in this. And also thank you to everyone who, took time on their lunch break or what have you to join us for this as well. As both of them have said, if any of your questions were not answered, we do encourage you to reach out to your primary doctor, your clinic, and your care team. And again, this video from today is going to be available to view on demand, and a link is also going to be sent to your email. And it wouldn't be a young adult webinar without me also plugging the fact that we invite you to check out the Young Adult Cancer Program webpage to learn more about young adult cancers and access to many resources that we have here at Roswell Park, tailored specifically for all of you. And as we wrap up, we do want to thank you again for tuning in. We hope we have been able to answer all of your questions. We here at Roswell Park, we're here for you. And, we want you guys to remember that together we have already tackled quite a challenging time, and we will continue to stand strong as we see this thing through. That all being said, stay safe, everyone, and have a wonderful day. Thank you.